Adam J. This 12-year-old boy has attended my surgery 5 times in the last 3 months with moderate exacerbations asthma, of his asthma. He has recently moved. Sorry. He has recently moved house, and the family thinks this is the reason for his symptoms. His lost attendance resulted in me doubling his flexitide to 100 micrograms twice a day. I have not started any other medications. I would be grateful for your help as he is going through many repeat prescriptions of salbutamol. Yours sincerely, Dr. D. McCann, General Practitioner. So this is the 12 years old boy and his mother for the history case, and he's a known case of asthma uncontrolled, and he is on Exitide, but still he has symptoms. So Dr. Irfan, shall we start?
Yeah.
Time, who will fix the time? There are total 32 minutes, reminder 9 minutes, 13 minutes finished with the with the patient, then remaining time with the examiner and reminder at 19 minutes. Anyone can fix the time, please? Okay, Helen, are you free to fix the time?
Yeah, I will fix
Okay.
the time.
Okay, please.
When you when ready, just
Okay, yes, I'm. Okay.
you can
Hello,
start.
good
Yes.
morning.
Good morning.
Yes, I'm Dr. Bakar, one of a children doctor here. May I speak with Adam and his mom?
Yes, doctor.
How are you, Adam?
At the moment, I'm okay.
Good. How are you, mom?
So I'm fine.
Okay. So, Adam, you have wear a nice color shirt. From
Yeah,
where you
thank you,
get it?
doctor.
Okay. So, Adam, I just come to know from your treating doctor that you are suffering from a condition like asthma, and it is not improving with the current treatment. Is that right?
Yes, doctor. Actually, I was doing well, but for the last 3 months, I have no control on asthma, frequent cough, and difficult breathing, cannot sleep. Like that condition is going on. Although doctor has given the medication and he also doubled the treatment which I was taking before, but still I'm not feeling comfortable.
Oh, really, it must be a difficult time for you, Mr. Adam. And don't worry, we are here to help you. And we hope that we will come to conclusion and you will improve the condition. So let me ask few questions from you. That Mr. Adam, what about your asthma? When it been diagnosed?
Doctor, when I was 6 years old, I was diagnosed with asthma, and
Okay.
I remember I was treated in the something like that high dependency unit, something like that, and they given something IV. That time I was diagnosed asthma, and then I got good control within
Okay,
two
that's great.
years. Then the doctor
Mhm.
discharged me with one medication that is Flexotide. So I'm
Okay.
using that medication, but I don't know what
Okay.
happened for last 3-4 months. I'm not feeling better.
Okay, I'm sorry about that. Mr. Adam, what about, do you remember that how many visits during last 1 year to the treating doctor, general practitioner, for this, because of this,
Well,
your
we are
asthma?
quite frequent, doctor. It's quite frequent. I remember it's more than 5 times.
Okay. Okay. So, mom, do you remember that how many times you took his blue inhaler medication from the pharmacy during last
Doctor,
few?
more than usual, I believe. It was very frequent. I even every now and then I used to go pharmacy and bring this blue inhaler for the Adam.
Okay. So, mom, do you remember that he's taking some oral tablet like steroid because of his condition is becomes more worse, and doctor gave the steroid
Yeah, doctor, actually,
oral.
he has taken multiple courses like this. For last 4 5 months, he has taken, I think, multiple courses for this. 3 days, 4 5 days, like that. It might be
Okay.
more than seven, like that.
Okay. And what about Adam? Is he having chest infection when he visit to the doctor with severe his symptoms would exacerbate?
Sorry, doctor, come again. I cannot get you. Please rephrase your
Whenever you
sentence.
visit, yes,
Yeah.
sure, ma'am. Whenever you visit to the treating doctor, to the general practitioner, is he having chest infection at that time when he developed his exacerbation of asthma?
Doctor, usually he has a cough and short and then difficulty in breathing. And cough is more distressing. Like that much he has. I don't get you. What do you mean by chest infection?
Yes, no problem. I will make it easy for you. For example, if he is having a visit to the doctor when you go for the cough and difficulty of breathing, at that time he is having a fever and doctor is giving him some antibiotic that he is having a chest infection.
Thank you, doctor, for your rephrasing. But I remember, no, not like that. He has no fever, but mild fever, like cough and cold, like that, but not much fever. They
Okay.
no, they
So,
never prescribe for antibiotics for him. I remember.
okay, that's good. That's good. Adam, do you maintain your diary of peak flow?
Doctor, before I was maintaining, but since we shifted to the new house, really I have disturbed everything. I cannot manage these things.
Okay. So, what about, do you feel, Adam, that when your symptoms are going to be worse, like you are exposing with the dust or anything else?
Well, doctor, you are right. Usually I get more symptom when I'm going to the dusty places. So I get worsening of the symptom, like I'm coughing more, like that. And I use blue inhaler for this, but I get relief for a short period of time. But again, I get this problem.
Okay. So, do you have any other feature, like do you have any skin rash or anything, skin spots on your
Yes,
skin?
doctor, when I was young, that time, after that, no more.
So, doctor has told you that you have an kind of eczema
Yeah, doctor, they
skin.
told me. And initially, when I was 4 5 years old, it was like that, but no more.
Okay, that's good. So, are you allergic with any food?
No, doctor, not exactly.
That's good. So, do you have pets at home?
No, doctor.
Okay. So, you have always your runny nose.
Never, doctor.
Okay. As you mentioned that, as your mom has mentioned the recent house movement. Is there any building construction near your new house?
Yes, doctor, there is some building construction going on. And usually, when I come from school and this construction is going on, I got dusty environment. And as I told you, it's gave me more problem.
Okay. Okay. So, mom, what about the house flooring at your house?
Where we have wooden floor.
Mhm.
Yeah,
And what about the birth of the Adam? Was it normal and smoothly going on?
it was fantastic. And we discharged from hospital within a day after
Oh,
delivery.
nice. That's good. Okay.
Yeah, thank
So
you,
after
doctor.
that, what about the feed during first few months or first few
Well,
years?
I managed to give him exclusively breastfeeding until 18 months of age for
Okay,
Adam.
that's great. Okay. So is he taking other medication other than his inhalers and as you mentioned the oral steroids?
No, doctor.
Okay. And what is there any family member who is suffering from the this same condition?
Was his grandfather have same problem, but not me and not my partner.
Okay. Any other family member who is suffering from any skin disease or any kind of allergy?
No, doctor.
Okay, that's it. And what about family members? How many siblings he has?
He has. There are two, doctor. One is younger
Mhm.
than Adam, and he's doing fine.
Okay, that's good. And what about smoking? Do you smoke or do your partner at home?
Well, my partner smoke. Yes, he smokes, but not me.
Okay, okay. So, what about your financial uh, concerns? Are you
Well,
working?
doctor, my partner is an engineer. I'm quite financially well off. No issue for finance.
Okay, that's good. So, what about his jabs? Adam's jabs, was it
Yeah. He is having
completed?
the he is yeah up to date. He has got all the vaccines, and he is
Mhm.
taking extra vaccine for the flu.
Okay, that's good. And what about his
Dr.
development?
Vakar, 4 minutes left.
Okay.
Well, he
What
is
about
going to normal school, doctor. He's having good grades each year.
okay, that's good. And what about his schooling education? As you said, he has normal grades, but is he having complaint? Is he having missing the school recently because of
Since
his
5 months,
condition?
doctor, yeah, right. Since 5 months, he has a problem, and he is quite frequently missing school, and this is the very worrisome for us, and this is the affecting. Otherwise, he is quite a good student, and he has remained in the top 10.
Okay, that's great. So he must be hard worker, boy.
Yeah, doctor.
So, Adam, have you ever forget to take your inhaler, orange inhaler?
Doctor, I usually take daily, but since the shifting in a new house and
Hmm.
rushing to school, sometimes I forget.
Okay. So how often you miss this inhaler?
Well, doctor, really, I cannot recall this thing, but I forget for sure.
Okay, okay. So, Mom, do you have any, what is your major concern about Adam's condition? What is your major worry?
Yeah, doctor is he is not getting better. This is my major concern. He was quite well, but now I don't
Mhm.
know what happened, and nothing is effective since 5 months.
Okay. So is there any other symptoms? Is there any other thing which I have not asked you and you want to tell me and which could help
No,
in history?
yes, doctor, you asked me everything. I given you all the answer. I believe I given you all the information required.
Okay. So one thing more I want to ask you that what about his other kind like is he having sometimes headache? Is he complaining of headache or is he complaining of some other problem of his tummy?
Doctor, you are right. Whenever he takes frequently this blue inhaler, he gets some
Mhm.
anxious like that. Sometimes he
Okay.
complaining of headache also. Otherwise, no special thing other than this
Okay.
problem.
His poo habits and he is normal.
Yes, yeah, he's normal. Okay.
Okay, that's great. So just I have completed. So
Yes, doctor.
yes, thank you, Adam and Mom. So thank you very much, and we will see and we will discuss with our senior doctor, and we'll come back to
Yes, doctor. Thank you.
you.
Kindly
Okay.
sum up your information from the history.
Yes. So today I took a history from Adam and his mom that Adam is suffering from asthma, which is
Okay.
he was referred from the GP. Actually, he is having asthma and on or inhaled steroids twice 100
Yes.
microgram. But recently, about his this condition, his asthma is not improving with this medication. That's why GP has referred here. And in the
Hmm.
history, which I have noticed that he is having history of eczema during childhood, and he has a one history at the age of 6 years in hospital admission because of his acute exacerbation, for which he took some IV medication, which most probably could be salbutamol or cephalin.
Yeah, doctor. Yes, yes.
Uh,
Okay. Fair enough.
and recent they moved the house, and as he is misses his dose of his fluoxetine, he is missing his doses when he is hurried to the school. And recently they changed the house, so this could be his recurrent exacerbation of his condition, his asthma.
Okay.
And
So
his
what
father
are
is also smoke.
yes, you are right. What are the triggers in this scenario?
Yes, trigger factors in this scenario, like he is having move of house. It could be is having construction or building, but new house. And the other thing is father smokes.
Very good. Well, anything else you consider in this history? What is gives you information from the Adam?
Yes, other thing I would like to check his technique, how he use the inhaler. First of all, I would like to check his technique, either it is
Very nice.
appropriate or
What?
not.
Okay. Okay.
Mhm.
Very nice. What else you will ask for further for this? Is in order to reach the problem, underlying cause, why he is not improving.
Yeah, other thing I would like to check the compliance. Either he is compliant with the medication or not.
So, what information is you have taken? Is it compliant?
No, he's not compliant. He's non-compliant because I asked him about how frequent he use. He said he sometimes forget and he don't remember how many times he forget. And
Okay.
but he is missing his dose.
Okay. Did you ask for the any pulmonary function test? Any helpful for this
Yes, I
condition?
asked about the peak flow meter diary. Either he is maintaining his peak flow diary or not. So he's not maintaining it during last few months because it's just a question.
Okay. Did you ask for the visit to grandparents' house?
No, I did not ask actually.
Okay. And what is the impact of the flooring on the asthma control?
Yes, usually they advise that it should be laminate flooring, and because it will having reduced the dust mites and it can impact on his asthma.
Okay. And it is helpful to be having a wooden floor.
Yes, it is helpful somehow, and sometimes they are also advising the anti-allergy mattresses, but it is also helpful, but it depends on financial and other conditions as well.
Okay. You ask question from mother that your partner is, are you smoking? And she
Mhm.
said, yes, his partner is smoking. Did you bother to ask he's smoking in the home, out of the home, and he changes dress, or how he comes after doing smoking?
Yes, actually, I asked this, do you and your partner, are you smoking at home? So she said that yes, my husband is smoking
But
at
you didn't ask he's smoking inside the home or out of the home, out from home.
home. Particularly, I did not ask, but at the initially I asked that do you smoke at home?
Yeah, that's the thing is that okay. Okay. Doctor, you have reached this patient. How you would like to manage this patient? How you will address? What thing you'll keep in the mind?
Yes, so is this Adam, and first of all, we will educate the parent and the child the importance of taking his of the compliance on the medication. This is the main
Okay.
thing which we should have. We should inform. We should educate them. If he will take
But
what
you mean
benefit he will get.
education, educate the parents and the patient.
Yes.
Okay. And
So, Mhm.
yeah, carry on.
So second thing, we will just check the inhaler technique, and we will ask the parents either on and off, are you checking his inhaler technique, either he used appropriately or not,
Okay.
and
What
is he
else you
having
want to?
appropriate devices. If he is not good and in checking either he is using any appropriate devices, he is under 15 years, so he can use some device, inhaler
Mhm.
devices,
Okay. What
large volume
else?
spacer.
Mhm.
Then we will encourage to use the peak flow diary, and which will
Very
help
nice.
us to manage his condition.
Okay. And
And then we will measure his growth parameters, monitor his
okay.
growth,
Okay.
and we will educate and address the parental smoking because his father is a smoker. So we will
Okay. Doctor,
educate him the impact.
did you ask
Yeah.
effect on the growth when you are taking history?
Actually, I asked the growth. The mother said he's fine and his education is also good, and I have no concern about his growth.
Yeah, but you didn't ask for the growth, right?
I think I asked about
You
growth
didn't ask.
development.
No, you are just said of development. You didn't
Mhm.
address growth.
Okay,
Yes. Yeah. That's
maybe.
why I wanted to mention this thing. And how about the management? How you manage the patient? This patient, how you will
Yes,
manage after education?
uh, yeah. After education inhaler technique, then we will encourage peak flow diary
No, that's okay.
to
But how you will manage?
okay.
That you done. You have given the education. You address the
Mhm.
inhaler technique. You emphasis on the pulmonary function test by the peak flow. Now, how you will
Mhm.
manage? What you will consider for this child? You will step up,
Avoid
step down.
triggers. Yes, okay. So first of all, is in the history, this child is seems to be non-compliant. So we will continue same medication, and we will force to compliant the medication and technique. Then we will
Okay.
see his the result of his asthma. If he
And
is
how long?
improving, we will
When
continue.
you'll call him back in your clinic?
Usually, actually, it is 4 weeks, 3 to 4 weeks
Very
of
nice.
period.
Okay.
But if it is having
On
he's having
very
severe
good. That's
symptoms, then he can come within week
yeah,
usually.
yeah. Suppose he comes to you again. On what ground you will step up and step down?
Yes, if he's compliant and he's maintaining his peak flow diary, and my parents are saying that his technique is good and he's
Very
avoiding
good.
triggers, then we can double the dose of his. If he's not improving after this all this, we can double the dose.
Okay. And if he is improving, what you will do?
Yes, if he is improving already, he is taking minimal dose. We will continue same dose, and we
Mhm.
will follow up the accordingly,
After 3 months.
at least for 3 months.
Yes, I think time is over, I believe. Huh? Nobody's giving the.
Hiren,
Hello?
Dr. Hiren,
Yes.
yes. What about
What is.
time?
Actually, you were going on
All good.
discussing, so I thought it's okay. Yeah. Okay,
Yeah,
so
anyway, Dr. Wakar, it was,
good.
mashallah, excellent attempt. And you started with the open questions, okay? And then you dig for the what happened and what is the background of this problem. And you started with the recent problem. Then you ask for all questions except 2 3 questions. Usually anybody can forget, okay? And you have to give them all the answer nicely. I think it was good.
Thank you.
Anybody can give, yeah. How you
Thank
feel?
you, Doctor.
It was tough?
If you satisfied, khalas, it means it was good.
No, you how you feel? It was, I think, how you.
Actually, yes, at the end, I was thinking that it becomes ups and downs because I did not ask the systemic questions I did
Actually,
in the end.
in the asthma, you have to ask, as you asked me the question, headache, tremors,
Hmm.
handshakes.
Hmm.
You already address all these things. Then loose stool in view of cystic fibrosis. You ask all these
Yes.
things. So that was covered. And you
Yeah,
asked for
covered.
the eczema, you asked for the rhinorrhea. So everything was covered nicely. So nothing left.
So anyone?
Just up.
Okay, we'll see.
Anybody else can give the feedback. But you given, mashallah, you did the good, good job. It was fantastic.
Thank you, Doctor.
Yeah.
Anyone else has the feedback, please?
Dr. Vakar, you asked for the school.
Yes, I forget. I'm sorry. I'm sorry. Yeah. This question was in my mind. I did ask because you didn't ask for the school nurse is know about this condition or not.
Ah, yes, important.
I forget
Okay.
because I was having in the mind. I forget to mention this. That's why I asked. Somebody can raise this.
Yeah.
I was asking.
Any
Yeah, right.
problem in the school? Any problem in the like school drop because of this problem? How?
No,
Okay.
because she already told me that he is good in a school. He's top 10 and his education is well, but recently he became down because of his.
But Dr. Vakar, I'm sorry to say. Sorry. I forget to mention because I was having in the mind. Social history was lacking because I was thinking to let you know.
Yeah.
Social history means your school, your friends, okay, and your home, okay. For sure, you dig about the home atmosphere and how it is. You ask a lot of things, but you didn't ask for the friends, okay, and schooling. School in the view of school nurse knows about this condition or not, and they are this thing you have to tell, and about the friends you forget this thing. Yeah, this was a minor thing. It will not affect anything. But if you ask for this thing, it will be a fantastic history. These two things were missing. Yeah. Otherwise, because I was having in the mind, I forget to write, so I skipped when I was discussing with you.
Okay. Other thing which I noticed, I forget to ask any surgery in the past, but it's not related with asthma, I think.
Well, if it's no, it's not. It's not relevant. Don't. We should not incorporate anything which is irrelevant. Relevant. If it is cystic fibrosis, yes, you should have asked for the surgery.
Okay. Yes, right. Okay.
Not in asthma. Past medical history, you asked before to. You asked me any other problem. You asked me other medication. You asked me, yeah. Otherwise, okay.
Okay. Good.
Hello.
Yes, Dr.
Yeah, actually, I did not hear, but history of weight loss in last 5 months is important here.
We discussed the growth.
Loss.
We
Yeah,
discussed the
actually,
growth.
growth and weight. Yeah, growth is long-term thing actually. Weight loss is acute thing. So specifically, weight loss history. Secondly, you asked regarding the orange inhaler, but like how he is taking with spacer, without spacer, any side effect of that, like any mouth oral thrush. That yes, but these are small things actually.
It's a minor thing. But if somebody is
Yeah.
asking if he has time, so one should ask for it.
Okay. So anyone has the videos in his system so that they can transfer, because I don't have any video of regarding this.
I think I have video which was given by Dr. Muhammad Ali. Not video. I have pictures only. Pictures.
No, I want videos.
Video should be video. No, I don't have videos.
Yeah. I will see. I'll
If
send
somebody has
group.
the master course, no, they have videos. If we got that thing, that would be very helpful.
Which master course?
Yeah, there's a MRCPCH master course book came long back, and they give
yes,
one
I
CD.
have in my computer. Oh, CD.
You have that?
Okay.
Yeah,
CD I don't
that.
have.
Yeah, master course that was.
Okay.
I think
CD
that is CD is there having video. If somebody can arrange that, it would be very helpful.
Okay.
So
okay,
it would be the session would be 2 o'clock every Saturday.
Not every. It depends on the My holiday. This Saturday I was off.
Okay.
Next
Because
Saturday
I
I
just
will see.
I hasted did get the rota. No idea